Ultrasonic rhinoplasty refers to the use of a piezotome or an ultrasound device to do the bone work involved in rhinoplasty. So rhinoplasty has lots of different components to it. The bone work, which is really hump reduction, narrowing of the nose bones. Sometimes we need to drill some tiny little holes so that we can put sutures through bone. Those are the parts of the rhinoplasty where ultrasound is extremely useful. So why do we use piezotome or ultrasound device in rhinoplasty? The main reason is for its accuracy. Now, I don't use it in all cases. There are situations where I don't really need to use it. But when I have thick nose bones, or if I want to be very, very precise about how much I mobilize the nose bones, for example, in a preservation rhinoplasty, then I think the ultrasound is very useful for that. So as an analogy, what I'm going to do is I'm going to take this very thin tongue depressor, which is probably similar to the thickness of nose bones. So remember, the nose bone is on a block. There's a nose bone on each side of the nose. They're thin. They have a certain shape and length to them. If I want to make the nose bones come inwards, I can fracture them with a chisel. I can push them inwards. I can, file them down with rasps. But what I like to do is make a very, very gentle cut through the nose bones, keeping all the soft tissue around it intact, and that helps to stabilize things after. So if I wanted to cut through the nose bone, for example, here, at that point, if I fracture that with a chisel, or if I push it in sort of manually, that fracture line can be anywhere, and it may not necessarily fracture right where I want it to. With a piezotome, what I can do is I can take that fracture line and I can actually encourage it to fracture exactly where I want it by cutting through the bone. So I'll show you how I do that. This is the actual tool that I use. And I basically just make a very gentle cut. I'm barely even pushing on this. You'll notice that the tongue depressor is not even flexing. It's not like I'm pushing hard on it. It's very, very gentle strokes. So now that I've cut through the majority of the bone, in this case tongue depressor, the tissues on the other side of the bone are still intact. And so once I've made that initial cut, I can fracture the nose bone exactly where I want it. So you'll notice that it's still attached on the undersurface, and we actually do that with rhinoplasty as well. If I want those nose bones to move in but be stable, I can maintain the attachments on the undersurface. So I find this is much more predictable than when I just fracture it with a chisel. So you can sort of see I can get a little bit of a bend in the tongue depressor. In the case with rhinoplasty, we're getting the nose bones to bend inwards, but it remains a bit more stable. So I like that. The other thing I'll sometimes do with the piezotome is once I've mobilized the nose bones, if I want them to stay in a very particular position, there's another little trick I like to use. This is an ultrasound drill. It's not actually sharp. I can touch myself with it. I wouldn't poke myself in the eye, but it's not particularly sharp. But I can actually make a hole with this. And so sometimes after I fracture the nose bones, I'll make a tiny little hole. And this is really easy to do and super fast. I make a little hole, and then I can put a stitch through the hole. One of the things I like to do, if I want to bring nose bones together, so if I've got a nose bone on one side that I want to bring in, and a nose bone on the other side that I want to bring together, I often will use the piezotome to drill a little hole through the nose bone, create a little space, and then I can put a suture through that. And then I can take that suture, bring it to the other side, and then when I tie the suture, it will bring the nose bone actively inward. And so it's a really nice way to narrow the nose bones without causing much trauma to them. So a little hole in the nose bone plus a stitch across to the nose bone on the other side can bring those nose bones together and keep them tight during the healing process. So another great use for this. I find it very difficult to get a drill in there to drill these holes, whereas the piezotome, I can make a hole through the nose bone that's really gentle and takes me about 5 seconds. So you can see I've got a couple little holes in there already, and it's easy to do with the piezotome. So, again, there's different tools that can be used to do the fractures in the nose bone so that we can narrow the nose, which we want to do in a lot of our cases. Whether you use chisels or rasps or even saws, I think there's lots of different ways of doing it. I like the piezotome, particularly when the nose bones are thick. I find it to be very accurate, and I do think it causes less bruising because it's not really traumatizing the surrounding tissue quite so much. Really useful tool. I use it all the time. It's not absolutely necessary in all cases, just depending on what I'm doing, but it speeds things up and it's very gentle. It's different from traditional techniques because first of all, we're using a powered source to modify the nose bones, so things can be done a little bit more quickly. The other thing is that because the ultrasound is oscillating at a very, very high frequency, we can actually make cuts in the nose bone or remove nose bones without actually having to put a lot of pressure on them. So if I were to use a chisel to fracture a nose bone, which I do, I have to put a fair bit of force on that with a little tiny mallet. So you need to sort of force the chisel through the tissues a little bit more firmly. Still an effective way to do it, and lots of people do it that way. But it does require a little bit more force. The other thing is that because we're doing it gently with ultrasound, the surrounding soft tissues are not damaged. I could use the ultrasound on my finger and it wouldn't do anything. So it's a nice, safe, and less traumatic way of mobilizing the nose bones or modifying them as part of the rhinoplasty. It's not all of it. You can't do an entire rhinoplasty just with ultrasound. There's other devices and there's other instruments that you need to use, particularly on the cartilaginous parts of the nose. But this helps to speed up the process and I think is a little bit less traumatic than the techniques I used to use. You know, we actually have patients ask if ultrasonic rhinoplasty is permanent. And it really is no different from other rhinoplasty techniques. And the idea behind rhinoplasty is to make a long-term permanent change to the nose. So yes, using the ultrasound does make permanent changes, but so do the other surgical tools that we use. Bruising typically is less with ultrasonic rhinoplasty because we're traumatizing the surrounding tissues less. So generally speaking, the bone doesn't bleed a lot, whether you use a chisel or whether you use ultrasound. However, the surrounding soft tissues, because the chisels are quite large, often do get a bit of damage to them and they tend to bleed more. The bleeding results in bruising. So bleeding from osteotomy sites on the nose tends to travel to around the eye. So yes, I think that the amount of bruising that we get with ultrasonic rhinoplasty is less than when we use traditional instruments. But keep in mind that bruising goes away either way. So long term, I don't think it makes a big difference for bruising, 3-4 weeks after the surgery, but certainly in the first week, I noticed that the bruising is less. I think the ultrasonic rhinoplasty technique can be used in any rhinoplasty case where modifications to their bones are required. So if there's a case where someone just needs modification of the tip or narrowing of the tip, these are all cartilaginous structures. There's no reason to use or a usefulness for the piezotome. However, if modification of the bridge height, the bridge width, areas where we need to drill tiny little holes in the bone to secure things, then the piezotome or the ultrasonic rhinoplasty tool is extremely helpful. The question was, is ultrasonic rhinoplasty better than traditional rhinoplasty? And I think that's difficult to say. The most important thing with rhinoplasty is the experience of your surgeon. So an ultrasound doesn't give you a good rhinoplasty. An experienced rhinoplasty surgeon is going to give you the best result.